This is our main stage presentation. I'm Anna Marie from Mix 92.9. We hope you're enjoying this day at the Virtual Baby Fair, presented by Nashville Parent and sponsored by Vanderbilt Health in collaboration with Baby and Company and Monroe Carroll Jr. Children's Hospital at Vanderbilt. Now, we're lucky to have the team at Medela here today. As the #1 mom and doctor recommended breast pump brand, Medela provides the best in research-based breast milk feeding products. We know Medela is committed to supporting every mom's breast milk feeding journey. And today we're pleased to offer a breastfeeding Bootcamp. I know a lot of you have been excited, like, where's the breastfeeding Bootcamp? Here we go with this. This is for moms to offer tips and insights on breastfeeding techniques. Let's welcome Irene Zoppi of Medela. Yay!
Thanks, Anna Marie. And, I just listened to that lovely presentation by Melissa, the nurse midwife. I was 38 and having our first child. Had no fertility issues whatsoever. My husband and I just met late and got married late. Our second child was born when I was 40. I had 2 healthy pregnancies. So everybody who just listened to Melissa's presentation, it's spot on. 35 is not by any means the time when everybody has issues related to their pregnancy. So thank you all for joining me on this session today about breastfeeding. And just to introduce myself, I'm the Senior Clinical Manager for Education at Medela. I am a perinatal nurse and I am a lactation consultant. And I'd like to start by congratulating every one of you out there, mothers and mothers-to-be, who are considering breastfeeding, because you are making a great decision on how to feed your infant. So I just want to begin by talking to you a little bit about what does breastfeeding mean for your infant and for nutrition for your infant, how to get off to the right start, what's going to happen in those first few days and in the hospital as well as when you go home. So, and I also want to talk to you a little bit about what to do before the baby actually arrives. I'm talking to you from Boston, so I think you might pick up a little bit of an accent that's not from the Nashville area. So let me tell you a little bit about what's so special about human milk. And I'm calling it human milk because it is that. All female mammals have the ability to provide nutrition for their infants, and human milk is specific to human babies. So I'll refer to it as human milk and then breastfeeding as well. So you might be thinking that providing your milk, your human milk to your baby, is just about providing nutrition, just about feeding your baby, but it's really about providing total nutrition for your infant, and that your body was already preparing for lactation while you were pregnant. At 16 weeks pregnant, you were already making milk for your baby. I bet you didn't even know that, and I bet you no one actually shared that with you. So providing human milk is about building immune protection for your baby for the first few months, but also for lifelong protection. And I don't know that families actually understand that component about it. It's not just feeding your baby today. And your breastfeeding journey is knowing how remarkable your body is to produce this wonderful food and fluid and nutrition for your baby. So human milk contains over 1,000 components that we know of, and we don't even know all of them. There's more that are being actually discovered. Breast milk is a living fluid. It's full of immune protection. It contains living cells, and it contains everything that your baby needs to grow, to develop, and to survive. A few of the many components that stand out we're going to talk about. We're going to talk about what are known as immunoglobulins, what are carbohydrates, and what are fats. Those are the main components in human milk. It's actually 80% water. I'll bet you didn't know that either. So even mothers who are breastfeeding their babies in the hot tropical areas of the world don't have to feed anything to their infants for the first 6 months but their breast milk. It has all the nutrients that a baby would need for the first 6 months. And that's the recommendation from the World Health Organization, for the American Academy of Pediatrics, is that babies receive exclusive human milk for the first 6 months of their life. Isn't that amazing how strong our bodies really are? So immunoglobulins are antibodies that fight off germs. What a better way to start your baby off in the beginning with a protection and immunization. And that's because of the immune globulins that are in your milk. And now more than ever, when you can consider what's going on with the pandemic, your baby needs this actual special extra protection. Carbohydrates are the body's #1 source of energy. And the main carbohydrate in your breast milk is what we refer to a milk sugar as lactose. And it's not only the main energy source, but it also helps to build better brain development. And there are special carbohydrates called oligosaccharides that promote healthy bacteria in your baby's intestine and also help fight off disease, like infant diarrhea. Fats are another source of energy, and the essential fatty acids from DHA and AA really help to build bigger, better brains. Who doesn't want a better, smarter baby and a better, smarter toddler? There's research from Brown University that has shown that all areas of brain development are affected by mother's own milk. And that's both the gray matter as well as the white matter. And we do know that the more human milk, the better the outcome. But even providing human milk for 3 to 6 months will help to build a better brain. And it's also very beneficial. Proteins build strong bones, and they strengthen and repair body tissue. And they also are needed to make hormones and antibodies as well. So you may have heard, and that's just some of the components that are in human milk. It's, as I said, a living tissue. So when you look under a microscope of a drop of blood, human blood, you'll see live cells. When you look under a drop of human milk under a microscope, you'll see live cells. When you put a drop of formula on under a microscope, you see nothing. It's inert. It contains no live cells. But you may have heard that formula is a safe alternative to breastfeeding, and many families actually think that too. It's artificial, and yes, it's an alternative, but the components of human milk are naturally produced. Human milk is the original organic food. Formula is processed canned food. It is the F word you can say. It's not poison. It is an alternative for those families who make that choice, or for those moms that feel as though that's the way that they wish to feed their infants. So what can you do before you give birth to prepare for breastfeeding? You need to educate yourself and the people you live with. Because breastfeeding is important to you, you need to tell them, this is something that's very important for me. I want to do this, and I need your help, and I need your support. You also need to learn as much as you can about breastfeeding. And in this COVID world, a lot of the live breastfeeding and birth classes have gone away. You need to look for virtual information, see what's in your community, what's going on and what's available online. Ask your physician and your midwife because they may have resources that you don't even know about that are going on in your community. So ask them for additional support. And when you're admitted to the hospital to have your baby, tell everyone, all the nurses, the doctors, and the midwives that provide care to you, that you want to hold your infant skin to skin right after delivery and you want to breastfeed. Every mom who desires to breastfeed should begin her breastfeeding journey in an appropriate manner. And this means mom and baby begin breastfeeding within the first hour and have repeated skin-to-skin contact. And research shows that what happens in the beginning, it will set you and your baby up long-term. And we've referred to this as the critical time period or the golden hour for getting your breastfeeding journey off to the best start. And what we said previously is that all female mammals are able to produce nutrition for their infants after they deliver. And this is the normal process for all female mammals. During pregnancy and right after delivery, milk production is based on a complex set of hormones that are automatically produced, and they are there to grow and nurture your breast to prepare for breastfeeding. After you give birth, your body will automatically transition these hormones, and there will be a huge shift in these hormonal levels. And you might be thinking you'll be pretty tired after delivery to begin breastfeeding and wonder if it's too soon. Well, it's not. It's really important to get it off to the the early start. There's compelling research that shows that moms who to meet their long-term breastfeeding goals, a lot has to happen in the first few hours and in the first few days. And building your breast milk supply early depends on activating the milk-making cells. And so your baby, breastfeeding a healthy term baby, will help to produce copious milk for them, barring pathology. But one of the best ways to do this is to get off to the best start right away. So during the first few days after birth, your baby needs to breastfeed often. How often? 10 to 12 times in 24 hours is pretty normal. Families need to know this because they think, well, I just fed my baby an hour and a half ago. How could he possibly be hungry? In the very first few days, this is very normal, and babies need to feed a lot. And we want to make sure that families don't mistake this as not having enough milk. Remember, your body began making milk for your baby long before he was born. This first milk is called colostrum. You have that present in amounts perfect for that healthy term baby when you deliver that infant. It's a small amount, but guess what? Your baby has been developing wonderful glycogen, glucose, and fat stores during the last several weeks while you were pregnant. And those healthy stores actually help this infant with the small amounts of colostrum. Colostrum, again, is a small amount, but it's perfect for this growing infant. Remember, frequent feedings are normal. So in order to increase those milk volumes, this is going to happen with your baby's frequent breastfeeding, and sucking will stimulate the release of hormones that will allow this to happen. In the absence of a healthy term baby, or if mom may have risk factors for suboptimal lactation. Melissa, the midwife, previously mentioned women who might have diabetes may have some issues with milk supply, but they still have colostrum. So they may need extra stimulation to their breasts, such as with stimulation from a breast pump that provides that unique initiation stimulation. And that would be something that your hospitals would have on board. So within the next several days after you deliver, your milk volume will increase. Some folks say that this is your milk coming in. You've had milk all along, so a better way to look at this is that your milk volumes will increase. And around 2 weeks, you'll be producing about 18 to 20 ounces a day, and that's about 3/4 of a quart or a liter or more milk a day. But what I want to talk to you about is how you transition from going home and that first night that you do go home. Your baby is adjusting to new surroundings and maybe actually starting to really wake up, and you're adjusting to being a new mom. In the hospital, you had help. Once you get home, you're on your own, and that can be pretty scary for new parents. It's normal for your little one to want to eat a lot, just like you did in the hospital. So what did we talk about? 10 to 12 times in 24 hours is a normal process. So remember that when you bring that little one home, that baby may want to eat 1.5 to every 3 hours. Sleep when your baby sleeps. Your most important motherly activity while breastfeeding in those first 2 weeks is to sleep, to eat, and to make milk. We really need that sense of urgency about a milk supply. And everyone in your family and all your friends need to be mobilized to help. So that means that you get to sleep, eat, make milk for your baby. And that everybody else gets to do all the laundry, all the cooking, and even in this COVID world, maybe put the dirty laundry out on the front stoop and someone can take it home, wash it, and bring it back clean. But we really need to help pay attention to what mother's bodies needs, and that means eat, sleep, and make milk for your baby, and get the helpers to do all the other work. And they really want to help. as we all know, families and friends do want to help. So how do you know your baby's getting enough? That's a question every mom wants to know. I can't see what I'm producing, and my baby's waking up every hour and a half. How do I know my baby is getting enough? And we know that by watching his diapers. We want to watch how many wet diapers he has and how many dirty diapers he has. At day 4, your baby should have a minimum of 4 wet diapers and 4 dirty diapers or soil diapers that have a yellow consistency to the bowel movement that the infant has. It shouldn't be black. It shouldn't be green. By day 4, it should be yellow, and it looks almost like what some people refer to as having seeds in it, or seedy. This tells us that the baby has been drinking enough milk. What goes in has to come out. And if it's not coming out yellow for the dirty diapers, then we know this baby has not had enough of mom's own milk. The other thing is that your baby's doctor or healthcare provider will want to see the baby probably within the next day or 2 after the baby's born or gone home from the hospital for a weight check, and to make sure that the baby is doing well. This is really important to make sure that you're getting that follow-up care. But the other thing, watch those diapers. Yellow seedy stools are telling us that this baby's transitioning well to the volume of milk that you're actually producing. Once you've established an abundant milk supply for your baby will trigger your body to make more milk. How? By drinking more milk. Breastfeeding more often. When we allow healthy babies to eat when they want, they figure it out. And that's what we talk about with this supply and demand process of human milk processing or production. Feed healthy babies when they're hungry. Don't watch a clock. No rules of waiting. And babies have growth spurts. So just like you and I, we might want to eat more in one day than another, and babies will do that too. Families need to understand that this doesn't mean that moms aren't making enough milk. The number one reason moms stop breastfeeding or introduce a supplement such as formula is they don't believe their bodies are doing what they're supposed to do. They don't believe that they can do this. If this didn't work, if breastfeeding didn't work, think about this. Our species would have died off. We need to remember how wonderfully magnificent our bodies are and capable of nurturing them through pregnancy as well as afterwards with nutrition. So don't worry about that process. When babies are gaining weight appropriately, they are doing beautifully. I want to talk a little bit about some changes that are going on with COVID in our lives. And I know our schedules have been a little bit off today with the presentation. So I want to just be cognizant of the fact that I may be running over here. With what's happened with COVID-19 is that our lives have literally turned upside down. What is clear is the benefits of breastfeeding and the current evidence of the insignificant role breast milk plays in the transmission of respiratory viruses, for example. UNICEF and the Academy of Breastfeeding Medicine, the World Health Organization, the Center for Disease Control, all state that mothers should breastfeed their infants. But a few practices regarding hospitals have changed since COVID. And some hospitals are testing all patients as they are admitted. So be prepared about that and ask about what's happening at your hospitals in terms of what practices are being followed. You'll probably only be able to have one person with you, a support person with you for your delivery and for your entire hospitalization. And you will be asked to wear a face covering or a mask, especially in the labor period when during the second stage of labor and while you're actually giving birth. Your hospital stay may be shortened and probably is shortened. This varies actually around the country. I've heard of some areas in South Carolina that have not adapted their post-delivery time or hospitalization time. Here in New England, it's now down to 24 hours. for a vaginal delivery and about 48 hours for cesarean delivery. So you'll be discharged earlier probably than you may have planned. But be sure to ask for breastfeeding assistance from the very competent nursing staff. They're there to help you transition to motherhood. They're there to help you transition to breastfeeding. They're very knowledgeable about breastfeeding, and they will help you. And if your baby is not doing well, they'll assist you with getting a pump that will provide the technology that you need to initiate that milk volume. And also you need a list of referral sources once you go home of who you can call if you should have problems. There's one more important topic I want to talk about childbirth, and that's significantly regarding your own health. Earlier, we spoke about those significant changes in hormones that take place after your baby is born. And these hormones are responsible for growing your breast, maintaining your pregnancy. But then they're involved in making a lot of milk for your baby once you've delivered. But there's a sudden decrease in some of these hormones that may cause you to experience a period of sadness or a feeling of unhappiness. We often refer to this as the baby blues, and you may have heard about this as well. And these are feelings of sadness that are increased by sleep deprivation, which new parents know all about. So what we want you to do is to take care of yourself as well as your infant. Talk to your partner about what you're experiencing. Communication brought you together as a couple, and communication will continue that as well. So open up to your partner and let them know what in fact you are feeling. Sleep when your baby is sleeping, and try not to be consumed by housework or caring for others. And although these feelings were normal after childbirth, they are not pleasant. Think about PMS times 10. It's important to know that the sadness will pass in a few days. What's not normal, though, is not being able to care for yourself or your baby. Speak to your healthcare provider if you are overwhelmed and not able to provide care for your infant. Your body, women's bodies, are amazing. Not only can our bodies carry and nourish our unborn infants, they can provide total nutrition for our babies. And think about that. You're a superstar, and you need to celebrate your star status. I'm so happy to have been with you today. Here in Boston, it's 75 degrees out. I'm excited to help you with your journey, and I look forward to perhaps some questions that may come forward even in our booth period process as well. Reach out to the booth folks, and if you have any questions, let them know, and we'll be able to answer them. Thank you all for listening in today. I hope this has been helpful.
Irene, you're fantastic. Thank you so much.
Thank you.
Irene Boffey, and we appreciate of Medela. We appreciate all that fantastic information that you gave us. I learned some things. I'm really excited about that. I love the fact that you're like, let everybody else take care of you, because that's a really hard thing for most women to do. And I'm glad that you stressed that. Thank you for all you do.
You're welcome. Thank you.